Hi, Dr. Greg Oliver. Welcome back. The average person finishes school and doesn't read another nonfiction book the rest of their life. That's pretty amazing. Books that teach us about things, biographies about other people, about geography, about travel, about, self-improvement, anything like that. We don't really focus on learning once we get out of the official schooling for the most part. Now, I've been fortunate enough being in a career of medicine where I had to learn on a regular basis or I became obsolete. I couldn't take care of my patients because the science and health and medicine is changing so rapidly that if you're not constantly learning, then you become an obsolete doctor, you become someone who can't help their patients. So I was fortunate enough to be in that area where I had to keep learning. But for the rest of us, we got to keep learning. And it comes to our own health. We need to learn about our own health. We need to learn about the disease processes that might affect us. We need to learn about our parents and our grandparents, maybe our grandparents' health if we can find out about that, because those genetics pass through us too. We need to learn what's important for us as far as our diet, what's important as far as our physical activity, what's important about dealing with our metabolic functions and dealing with any disease processes we have. We need to learn about those and become experts in our own body and our own health so we can become the person that we want to become when it comes to fitness and health and vitality. We can live not just a long life, but an active long life. And I almost all doctors and nurse practitioners and physician assistants, they care about their patients. But here's the deal. You as a patient have to be actively involved in that. Don't just depend on them to take care of you. Don't be that person that goes in and says, well, doc, whatever you got to do to treat me and make me better, you just do it. I'll trust in you. And that's okay, but you need to be involved. You need to ask questions. You need to figure out why they're treating things, what they're looking for, why they think there may be a problem. And if someone doesn't want to talk to you about that as your provider, find another one. But get involved, keep learning, learn about yourself, learn about health, learn about fitness, and become fit, lean, and live life to the fullest. We'll talk soon.